Hi, good afternoon, guys. My name is Jomar Ferralis, Doctor of Physical Therapy. I just wanted to hop on here and just give you guys a little bit of an idea of what I do as a home care physical therapist. So I do a lot of evaluations for patients either being discharged from the hospital or from a nursing home. A lot of times we get physician referrals as well. So my role is to help and to assess how they are getting around at home, how their mobility is, if they're having any pain, and try to get them back to where they were prior to their hospital stay or to improve their current function. And so one particular thing I wanted to discuss with you was chronic pain. So as a home care physical therapist, I deal with a lot of patients with chronic pain. And chronic pain is very difficult sometimes to get on top of. And a lot of these patients do need medication regimen to help mitigate and control their pain. So a lot of times they're on Tylenol, oxycodone. They may go to a pain clinic. So a PT's job is very important in this regard. So a lot of times I've found that patients are given the impression that their pain is simply from one thing. So for example, a patient that has an MRI or X-ray performed and the MRI finds a bulging disc at L4, L5. A lot of times, while it might have a role in their pain level, it's not always the answer to what's exactly causing their pain. You got to look at the patient from a bigger perspective. So you got to look at, their MRI imaging, things like that. Those things do matter to an extent. A lot of times too, it's the patient's prior level of function. What were they doing prior to this pain that's debilitating? Also, you got to look at their psychosocial factors. So do they have any depression or anxiety or past history of trauma that may exacerbate their pain and make it worse? A lot of times these patients are given the wrong impression that just because you have this pain, you're not able to do anything and that you shouldn't be doing anything else. So I try to educate them as much as I can about the safety of movement and how important it is to get moving, even if you are in pain, because if you aren't able to move, the pain's only going to be exacerbated and potentially become even worse. So that's my role as a physical therapist. If you do have chronic pain issues, please get evaluated by a skilled physical therapist, someone who knows what they're doing, someone who has dealt with chronic pain before. And that's all I wanted to hop on here for. Have a great day.